And one thing that really was interesting to me about SPRY was just the fact that there seemed to be a lot of tech related to the AI portion of things. And I was really excited about that because I felt like that could be really beneficial for us as therapists and really help the team. And we struggle as a team with paperwork and with notes. And I think a lot of it's just the one-on-one nature. You think having a lower volume, it would be less stressful, but because you're not breaking from those patients at all during that hour that you're with them, it actually was more challenging for us to get our documentation done. So I just felt like this will be really good for our team in terms of getting their work done. And it's proven true. Chris, my business partner in DC, and I both love it. And we were probably the two that struggled the most. And we use it for every single patient. We do get their consent for an audio recording, but we use it for every single person. So yeah, I think it's made a huge difference, probably even more than I thought when I originally kind of heard about using AI. And it's different to me than just doing dictation. Dictation is very different. You can use that feature, but being able to actually record the session, record parts of the session, has been a game changer for us. No, I think it was definitely really interesting. What's been good is I feel like there's been great updates that have been made even over the last 6 months. And there was an update that came about where basically the AI is recording on the right part of the screen, and then you can still look at your note on the left part of the screen. And when that update was added, it really did change things. I had a little bit more of a challenge before that because I couldn't look at my previous note and I got confused. But then they added this update and I could scroll through my previous note. And at the same time the patient's talking, I'm able to make eye contact, everything's getting recorded. And then I can kind of say, I try to remember to say like the objective things I'm doing, so that the AI will pick it up. And this latest update I just saw is like it's starting to put it in more specifically, in terms of if you say that there's like range of motion in terms of like left internal rotation, it's going to put it actually specifically where it belongs, and that's been a big update as well. So now I'm using it a lot more in the sense that I can kind of like look at what's recording, kind of see my note, and then I have the option at the end to kind of look through and check it. And so yeah, with a couple of these latest updates, especially the one where I could still visualize a note, it's made a big difference. Let's think about this. I've had, like I said earlier, like we do treat like a complex group of clients. Some of them are like, standard orthopedic patients that physical therapists are used to getting. But again, a lot of them have very complex histories. And so really being able to go back and look at all the things that were going on kind of before. I'm trying to think if there's a good specific example that I could give you with it. I believe like there was one I had, and I think just being able to kind of go back and look through his history, because again, it's recording stuff and I just kind of forgot about it. And we were able to kind of come up with the fact that like what I did is I took some of that information and then that I pulled from Scribe, what he told me, and I didn't really put the details together and I wouldn't have picked them all up, right? So I took all that information and just kind of data dumped it into a separate AI, which is just like I use like a ChatGPT type of program with obviously no HIPAA information, but just some symptoms he was experiencing that he had mentioned from his subjective. And it really pointed us into the direction that he had a vascular issue. And it was much more vascular than it was more like neurological, which is how it kind of kept presenting. So I wouldn't have picked up on that because I wouldn't have recorded those little details that he said, just because I probably would have just blown them off. But he was talking about some specific areas of pain. And this is a pelvic health client. And so we talked through it. I did a little bit more research, referred him to a vascular person. And as a result of that, he had a major occlusion. And it turned out like he got that fixed and it made a big difference in his symptoms. And I think like I just wouldn't have written it down. Like the way he described it, like it was very clear. And I would have just said pain because I would have been trying to write fast. But when I kind of like took all that information and then put it in, and did some more research on it, it's like, okay, I'm kind of seeing how this could be something else. And of course that's outside my scope, but I was able to like then at least point him in the right direction in terms of a referral.